we underestimate that sometimes, the handling of insurance claims, answering questions about insurance or about payment processes really provides, I think, assurances to patients, puts them at ease. When I started my career in healthcare, I remember seeing patients and interacting with patients and, being able to observe that, when they came into the hospital, they weren't comfortable, they were scared, quite vulnerable, if you will, and they looked to the folks in revenue cycle who were most often their first point of contact. And those were the folks that set the tone for their entire stay. They provided that assurance that everything was going to be okay. And I know that they were scared more than just about their health condition. They had some anxiety about the care they were about to receive. They had no idea what that was going to be like. And they also had concerns about how they were going to pay for it. And that was largely our responsibility in the business office, was to walk them through that. That truly sets the tone for their care. And I think it actually even plays a role in their care and their healing, because a positive experience really puts patients at ease. Negative feedback you get from patients really tells you something about your revenue cycle operations. We chose to partner with Ensemble a little over, well, actually, no, it was last October when we started. And, prior to that, the complaints, the concerns were many. But over the past several months, we've seen that just consistently decline. It really is a testament to, I think, that we are making a difference, and that people are finding answers to their questions and their concerns from the folks who are doing the work. Having personally had experience being a patient or having family members be a patient, it was obvious to me when you receive care at a facility that might be struggling financially versus one that seems healthy and robust. And certainly, it does make a difference. It makes a difference in the perceived care you receive. It makes a difference in the amenities that you're afforded while you're a patient. I know that when we considered that lift that we would expect from that partnership, we knew that we had needs. We were coming off a very costly investment into a new electronic health record using the Epic platform, and it really tapped into our financial resources to be able to fund that kind of initiative, and it did. So the lift we were able to receive, or we're receiving from working with and partnering with Ensemble, helps us to overcome that investment. And then we use that money. We use it for future investments in technology and service line development. In Lewiston, for example, they're opening a brand new infusion center within their hospital. So they're going to be able to provide infusion services to the people in their community. Much needed. Couldn't have done that without that lift. They have plans to add 3D technology for mammography at their hospital. Again, great enhancement to services, much needed. Part of our mission at Covenant Health is to make sure that we're taking care of the poor and the vulnerable. At St. Joseph's Hospital in Nashua, they sponsor and fund a program called Project Hope, where they take folks with learning and developmental disabilities, and they basically train them and allow them to do rotations through the hospital and learn skills. And they go on to find jobs within the community. It's a fantastic program, one that I certainly want to highlight. Another I think is exceptional is in our Lewiston market at St. Mary's Hospital. They have a food shelter, if you will. And it's more than just a food bank. It is a food bank. It's located in one of the areas in their community that has the highest food insecurity. But they also go above and beyond through food deliveries. They also have cooking classes where they invite folks to come in. Not only are they providing the food to them, but they're teaching them how to prepare it. Exceptional program. And I could give you many other examples, but those are just a few of the ones that stand out in my mind. In the non-clinical side of the business, sometimes you feel that disconnect from being able to lay hands on a patient and provide direct care and healing. But I would say for revenue cycle staff, never underestimate the impact that you're making, because it's because of your work, your efforts, your time, your talent, that we're able to, as a system, as a facility, provide such great care. No matter what the responsibility is that you have in revenue cycle, it's an important one, and it certainly contributes to the whole. And we're all part of this team, and this team's all focused on the patients and providing the best care we possibly can, and we're all important. And that would be my message: is never underestimate how important you are in healthcare.